Welcome to today's podcast. Our guest today is Ellie Calhoun. Ellie started her career as a licensed massage therapist and quickly learned firsthand about the power of Rossiter stretching technique to get out of pain. Rossiter became an integral part of her work with clients and sparked her to continue to learn more about the human body and anatomy. She has studied core movement integration, neurokinetic therapy, breathing methods, and lymphatics, integrating these in her own life and her work with clients. Ellie is dedicated to helping people take charge of their wellness, learning best core movement and breathing practices to achieve a pain-free body so they can gracefully and joyfully live life to the fullest. She believes that with the right tools, mindset, and practice, we can move with ease and get better as we get older. Currently, Ellie is working on an online course so more people can learn about taking charge of their wellness by learning about their own bodies and movement patterns so they can live a full and joyful life. Welcome to the podcast, Ellie.
Thank you, Peggy. Thanks for having me.
Oh, I am looking forward to
Hey.
this conversation. I'm so curious and interested about the different methods you use. But before we dive into that, can you share a little bit more about who you are and what led you to become a massage therapist?
Well, so I'm a mover. I move all the time. I growing up, I used to race on the dirt roads barefoot, and we ran, we played, we moved, we climbed trees, we did all these things, and to me that was joy,
Mm.
right? And I was also in sports, and I played field hockey, and I was pretty good at it. And in college, I hurt myself. And I also started understanding that, sports wasn't really going to be my career. So
Mhm.
I was also deciding that my studies and academics were more important. So I stopped playing field hockey my senior year in college. But the injury and the difficulty and chronic pain issues in my body continued. And I have gone back and forth with feeling okay and trying to do exercise and injuring myself, and feeling okay and try to run or try to do all the different things. So pain and injury, and dealing with that often really limited me in what I could do. And so, fast forward to 48 years old, my youngest is going to kindergarten, and I decided I was going to go back to school for massage. And massage, it, I have to say 50% at least of the reason of doing that was to figure me out and
Ooh.
what was going on with me and my body, and how could I fix that. I'd been to doctors a little bit. I'm not big on that, but enough to realize that they didn't really know. They just throw things at you. Oh, try this. Oh, try that. And
Mhm.
so I kind of understood that I needed to figure some things out for myself. So I became a massage therapist. Um, and love it. I then, as it said in the bio, I quickly learned about Rossiter stretching, which was a way of getting out of pain. It's a stretching. It's kind of like a pin and stretch, only as the client, you're the one that is in charge of how much the pin, how much you're pinned in, how much you move, and it really got to the pain, and I was amazed. So that was the first thing that kind of like propelled me along to also understanding that when people are out of pain, you know what? They're kinder, they're more
Mm.
compassionate,
Yeah.
we think more clearly, we have better progress in our lives. And so when I do have a client, one of the first things I do is address their pain.
Mhm. That
So
is
I could keep going.
interesting. Oh yeah, just keep going. Yeah. I mean, I want to know a little bit more about, this stretching and how to eliminate pain because we know, yes, you're truly right. When we feel good, we are better people. We
We
treat
are.
each other better. We treat ourselves better. Can you enlighten us a little bit more about this Rossiter stretching technique?
Specifically about Rossiter? Sure.
Yeah.
So Rossiter works on the connective tissue in our body, fascia. And so connective tissue is a soft tissue. So we have muscles, we have bones, and so the muscles attach to the bones with connective tissue, tendons, ligaments attach bone to bone. So just as a quick, brief
Mhm,
background. So
mhm,
fascia is a connective tissue that is throughout our whole body and connects from head to toe, sideways, front, along the back, crossways. It's everywhere. And so you might have an injury in your head that affects your opposite hip because of that fascial line. Or maybe your shoulder hurts because your foot hurts. And we don't always know. And that's, excuse me, that's the beauty of treating the whole body is
Yeah.
because, so when I have somebody come to me and they're complaining, so client yesterday, sciatica in his left side. I didn't
Mhm,
even touch his left side and he felt better. So, and that was strictly Rossiter. I do other things that also help with
mhm,
that.
mhm,
But so Rossiter is I use my whole body weight and I step on an area that, so if somebody, for instance, had elbow pain,
mhm,
they would be lying on the floor, fully clothed, lying on the
mhm,
floor, and I would step on a pretty intense spot in the forearm.
mhm,
And this is completely safe. It's quick, it's effective, and it, for a lot of people it
mhm.
works immediately. The
Wow.
next day they feel better. So then after I step, they do a stretch, a nice slow movement of their body to really release and work on that
Mm,
fascial
mhm.
restriction that's
Yeah.
happened
Yeah.
in their arm. So that's what Rossiter is. But over time, I've learned that we may not really be stretching
Mm.
fascial tissue. We're actually working with the brain
Ah,
and
yeah,
the
it's all
nervous
connected,
system.
right? It's all connected.
It's the nervous system that's in charge, right? And
Mhm,
so you can have pain because of an old injury
mhm,
that hasn't let go. You could have pain because of emotional
mm,
situations. So
right.
we don't always know exactly what we're treating. and so it's about the nervous system, but it's also about the individual because every single individual is different and is going to
Yeah.
respond differently and is
Mhm,
going to need something different and need a different approach to the
mhm.
issue.
Yes. I mean, we're all unique. We don't all represent the same things. I could have the same elbow injury as somebody else as presenting, but it may have been a totally different cause or where it is in the body. But I'm glad you brought up that sometimes physical pain is stems from emotional. Because I'm a formal mental health therapist, so the
Mhm,
emotions
mhm.
is something I deal with, but I've had to, kind of educate people about how the brain and the emotions work, that it may, come out as a physical thing, and we don't know, so we have to try different things.
Right,
So
right.
Rossiter is just one, like a stretching technique, but you
Mhm,
also in your bio mentioned core movement and breathing. Can you tell
mhm.
us a little bit about how those help people achieve more pain-free?
Sure. Sure. One of the things about Rossiter, I'll start there just
Yeah.
because it all led up
Right.
to
Yes.
where I
Yes.
am today, is that Richard Rossiter, who is the person who the founder of the Rossiter system, he talked about walking. Walking is what we're meant to do as humans.
Mhm.
And that walking helps integrate any change that happened during a roster stretch. So then I became interested about walking and
Mhm.
how do we walk? What is optimal, right? I mean, we
Right.
all walk, but
Right.
we all walk in very different manners, right? And
Right.
some of them are functionally good and some may not be so good.
Mhm.
And so I really started to think about, oh, walking, and that's movement. And I happened to find another mentor of mine, Joseph Delagrati, who taught core movement integration. And he's a Feldenkrais practitioner. So I'm not going to go into that, but basically it's therapy through movement. So it's moving mindfully and consciously to move more and move better, if that makes sense.
Mhm.
And it's how do I explain? It's so that moving, he actually had a walking workshop, and I took his walking workshop. And then I also I took his walking workshop, and then I decided that I needed to do this work and as a practitioner. So I became certified in
Mhm.
core movement integration. And so what it is it's mindfully moving from your pelvic area, the core part of our body, where this and our core supports our extremities in the movement and the things we want to do. So if we
Mhm.
want to lift something up, so for instance, if we want to lift something up and we just use our arm, right, then where we may be, especially if it's repetitive or with something heavy,
Mhm.
we
Mhm.
may be compromising the small muscles in the shoulder. But if we use our whole body
Mhm.
movement to support that extremity movements. It all starts in the core. And if I
Right.
stand up, I'm going to get out of your screen. So I can't really stand up to show you. I'm actually sitting on a chair that
Uh-huh.
helps me move from core movement.
Oh,
And
yeah.
so I there are there are three planes of movement, right? There's
Mhm.
the plane where you go forward and backward,
Mhm.
and that's
Mhm.
the lateral planes, right?
Mhm.
And
Yep.
then there's rotation.
Mhm.
And we use all of those in walking.
Mhm.
And sometimes people lack one of the others. So sometimes you see people walking like this,
Uh-huh.
side to side, because that's a very stable base.
Right.
And
Right.
you're not stable in your core, you might end up doing this. And then there are people who lean forward, or people
Mhm.
who extend backward too far,
Mhm.
or people
Yep.
who most people lack in rotation. Rotation is tough because our ribs sort of get in the way of much movement in our spine.
Mm. Yep.
So core movement integration also connects. It connects the movement in the greater trochanters and pelvis and the legs through the ribs and into the spine. And so it's connecting, and it makes those connections all the way up and into your head.
Oh, that's
So,
awesome.
and it's a lovely way of getting your body started in the morning. So I've taken my daily routine, my
Mhm.
daily movement practice
Mhm.
is first I do some lymph work, then I do some breathing work, and then I do my core movement work. And it's very mindful, meditative. It's very gentle. It's not to like get strong muscles kind
Right.
of,
Right.
but it's just to get all those little parts connected and moving.
Mhm. Mhm.
Each vertebra in our spine is supposed to be able to move,
Yeah. Yeah.
right? So that's core movement. Breathing became another thing. So first I was like, okay, massage is going to fix
Yep.
me, right? And then I was like, Rossiter, oh, Rossiter, that's great, that's great. And then I was like, oh, wait, it's all about movement. So I started really delving into the movement part, and then I learned about breathing, and I was like, oh, it's all about breathing. And my most recent thing is it's all about the lymphatic system. With that,
The more
and
we learn, the more we learn, right?
right. So it's really an interweaving of all these
Mhm.
things. And so my goal when I work with clients is to help them learn how to sort of assess their own bodies, know where they are,
Mhm.
so that then they can move to where they want to be.
Mhm.
And we often, like when we decide we want to get in shape, we go jump into the gym and we do too much. Well, I know I don't go to the gym, but yeah, that would be my pattern.
Yeah.
Oh, I'm going to walk 10 miles, and I haven't walked
I'm gonna lift these weights,
months.
heavier weights than in the
Right,
improper
exactly.
movement.
Exactly, exactly. And without that intrinsic core strength and stability here, you compensate. And the compensations are brilliant. Our brain is brilliant. But that compensation taxes something that isn't meant to do that, and
Mhm.
then we get an injury.
Yes.
So when I do assessment with people, I use I use a variety of movement assessments, but I also do neurokinetic therapy, which is looking at function and whether or not there's a compensation pattern
Mm.
happening.
Uh-huh.
And then when you get the attention of the brain and you release the thing that's overworking and activate the underworking piece, you get it back to balance. And the brain can relearn, and that can help people get out of pain as well and relearn how to move. So
Mhm.
I work with people on a program basis, like 10 weeks, pretty
Mhm.
intensely, twice
Yeah.
a week. I meet with them and I incorporate all these pieces so that they can have the tools to feel better as they age rather than, and they know the steps. And
Mhm.
then later when, life hits us all the time, we're going to have
Right.
challenges all the time,
Yeah.
right?
Yes.
It doesn't mean you're not going to have an injury. It happens. We have an accident, we
Yeah.
fall, we whatever. But if we can stop for a minute
Mhm.
and tap in and know what is our body trying to tell us, and then make our best decisions based on that,
Mhm.
whether that is bringing in a medical doctor to help you, or a PT, or a massage therapist, or not. Um, you're coming from a place of making the best decision for you. I
Mhm.
think that people have a tendency, and I think I've gone off track here a little bit, but
Oh.
I think people have a tendency to jump to the I need to see a doctor right now.
Mhm. Mhm.
And maybe, but if we weren't in this panicky, I don't know anything about my body state, yeah, you might need to go to your doctor. But if you can calm your nervous system down,
Mhm.
sit with it and think it through, and you have some tools
Right.
that you know to do, like breathing. Oh,
Mhm.
can I tell you a story?
Yes, please do.
So one day I was in the kitchen, got up in the morning, I was getting my coffee ready, and I yawned. And when I yawned, my jaw stuck open. So dysfunctional jaw issue, right? And I was like, and I clamped my jaw shut as fast as I could. And then I was stuck. And the pain was pretty good. It was pretty good pain, but I couldn't open my mouth. I couldn't chew. I couldn't eat. I immediately contacted my chiropractor who did some work that helped, and then I did some work that helped.
Mhm.
But my jaw, I couldn't. I had to. I had to limit my yawning. I couldn't yawn a full yawn, and it was achy for months, months, months. And I finally went to someone who does. I took a neurokinetic therapy class, and the teacher assessed my body and figured
Mhm.
out a pattern. So I worked on that pattern and the pain was gone.
Mm.
Fast forward a few more months and I yawned again and my jaw stuck open again. But this time was different. I didn't panic. I went, oh, what do I need? I went into the living room. I lay down on my back on the floor. I let my body reset. I did my breathing and it reset itself. It was like a dislocation, I guess, just kind of
Yeah.
reset. And then I didn't have the months of aching after that. It was
Mhm.
just no pain. So that was cool.
Yeah. No kidding.
So that's sort of an example of calm it down, take stock, figure out your next step.
Yeah. Yeah.
And you might have a different result.
Well, that's a great example of how to be tuned into your body. Well, first you didn't quite know. So then you had to go through a few months of aching and paining and figuring it out. But the next time it happened, you were better in control because you knew the next steps of what you needed to do. So that's kind of what you help clients with as well, is that
Mhm.
you give them the process and you give them the tools so they can do it themselves, correct?
Exactly, exactly. And the
Awesome.
biggest takeaway my clients get is they turn their focus inward
Mhm.
and become really aware of their body and how they step onto the ground as they're walking and how their body's moving and what they're doing. And once you become aware and you have that curiosity about your own body,
Mhm.
it's like it's amazing. I have clients come back, they're like, "Oh, I noticed this, and now I'm walking in the grass barefoot," and, so it's exciting. It's like
Yeah.
relearning what we as children we had this joy of movement when we're
Mhm.
children, and, many of us, maybe not all, but most of
Mhm.
us may, and so it's coming back to that. It's coming back to yourself and giving yourself the time to do that.
Yeah.
We're so busy and so
Oh,
rush,
yeah.
rush.
Right, right. So on that, like, can you give one or two, like maybe specific examples of maybe a breathing technique that maybe the listeners could take away and do a little bit on their own? I know that it's better if you're working with somebody on this, but is there any tip or something that listeners could walk away with that they could
Yeah,
try?
sure, sure. And the thing is as I said, I work with clients one-on-one in this program, but I'm building a course
Mm-hmm.
that's going to be based on that. That will be virtual. It will be, I don't know if it'll be live or if it'll
Right.
be a one-off kind of thing,
Mhm.
but that will give people a starting point because
Yeah.
that's really what we need. We need to
Right.
know where do we start.
Yeah.
Um, in terms of breathing, the first step is being able to use your nose. So inhale. You can exhale through your mouth, but if you can inhale through your nose, that's best. There's a reason why we have a nose for breathing in. It triggers things and it moistens the air and it filters the air. When we breathe through our mouth, we're not getting that. We're also the breathing is a whole huge thing.
Yeah,
So
I know. It's hard to narrow it down and be
yeah,
really
I'm going to move
specific, but we
back.
all do it and we don't pay attention to it. So,
Right. So when so that being said, I talked about breathing, inhaling through the nose. It's not an active drawing in of air through your nose. So we have a big muscle goes all the way across. That's our diaphragm. And when that diaphragm contracts, it dips down.
okay.
And when it dips down, it sort of pushes the contents of your belly out. And that's why people talk about the belly breath, right?
Mhm.
Because you your diaphragm is coming down and you should be able to feel your belly sort of expand as
Mhm.
opposed to going in.
Right.
So a lot of people, the first thing you can do is find out, are you a chest breather or are you a belly breather?
Mhm.
And you can do that by putting a hand on your abdomen or right underneath your ribs and another hand here, and then take a deep breath in. And if you notice your top hand move first, like this,
Mhm.
then you know you're a chest breather. There's no room for my diaphragm because my belly went in.
Okay.
So practicing letting that belly, and it's not pushing it out, although you might push it out just to kind of feel what it feels like, but
Mhm.
just allowing it to open up and
Mhm.
expand here.
Mhm.
Okay. If we're running, we do end up using these muscles and breathing up in here because we need to. But
Mhm.
if you're breathing up here all day long, that's a lot of breathing for these muscles that aren't really meant to do
Yeah.
that much. And
Yeah.
then you start having neck pain and shoulder pain and that sort of
Okay.
thing, perhaps.
Yep.
So, so what you can do is when the diaphragm dips down, it draws the air. It's like a vacuum, right? It draws the air into your nostrils. So, if you're going to do this, clean out your nose, make sure you have space and that you can inhale through your nose. You close your mouth, but don't clench your teeth. Place your tongue on the roof of your mouth, like a kind of a place, right? That's where our tongue should be placed on the top part of our mouth. And then inhale maybe to the count of 4 or 5, and then exhale. And you can exhale through your mouth if you want or through your nose. And I usually exhale at least twice as much as I inhale. So we could do it again. And as you're exhaling, the exhale is your abdominal muscles contracting to push the diaphragm back up.
Mm.
So the diaphragm and these abdominal muscles are antagonists. They work together. This relaxes as the diaphragm goes down, and as these contract, it pushes the diaphragm back up. If you exhale for as long as you can,
Mhm.
nice slow exhale, you'll be able to feel these muscles working. So let's do that. We'll breathe in to the count of 4 and then exhale for as long as you can. Okay. So, and then inhale
What
again.
I'm
Could you
thinking,
feel that
oh,
muscle?
I did. And the first thing that came to mind is how often that we are like, I don't know if the correct term is contracting our stomach so that it goes in and just so that we look like we have a flat stomach and how that affects our breathing.
Definitely. Definitely. Right. So breathing is incredibly important. So breathing's connected to our emotions, right? So if your emotional or your thinking or your thoughts are, oh, I didn't pay that bill, oh, you get this kind of, and then you start to either hold your breath or breathe this shallow,
Mhm.
that's telling your brain that there's danger.
Mhm.
Okay. And so your anxiety level is high, right?
Right.
So if you find that your thoughts have turned and you're anxious about something, take control of your breathing and it will help you reduce that.
Yeah.
Sometimes my daughter, she'll come up to me and she's like this.
All
And
frazzled.
I'll say, "Well, Samantha, take a breath in." And she'll go, and I'm like, nope, take a breath in. And now breathe all the way out. And as soon as she breathes all the way out, she's like, oh,
Yeah.
okay. And then she can think
Yeah.
and she
Yeah.
can realize what she was all hyper about wasn't as big an issue as she thought it was.
Right. Right. Our breathing is so important because it helps, it's our control system kind of like because it can rev us up and get
Right.
us all wound up or it can calm us down.
Yeah.
So
And
being able to breathe through the nose and find that diaphragm just can work wonders.
yeah, there are some great apps out there that you can follow the breathing on so that you can practice it.
Mm.
Practicing these things is important because when you're practicing, you're not actually in a situation where you need it.
Yeah.
But if you practice it enough, you'll have access to it when you need it.
Hmm.
So if you do have to dodge a tree coming down or something, you have some ability to access your breathing and your stability in your core.
Right.
Um, so the practice piece is important.
Hmm.
I think, I like to think that my practicing breathing will help me in my future,
Yeah.
right?
Right.
So we don't know what the future is going to bring, but can we be in our best selves
Hmm.
when it comes? There's no way to test whether the practice is going to help or not, but I like to think that I like to be as ready as I can be for my future.
Oh, yes. And I think no doubt practicing our breathing, one, we're never really aware of it very often unless we have a hard time breathing. Maybe we have, for me, I'm a nose breather. I know that I am. So if I get a cold and I'm stuffed up, I'm miserable because I can't
Mhm.
breathe the way I want to. And
Right.
so to check in, we all breathe many, many times a day.
Mhm.
So if we just check
Yeah.
in once in a while, we can tell whether or not, and we go, oh, that might be linked to, oh, I might feel tense, or
Mhm.
I'm revved up on my emotions. I'm more anxious, and then trying to breathe, and you're like, oh gosh, that's
Mhm.
relaxing,
Mhm.
and you can kind of think better. You can concentrate better. So
Right.
practice is really key because we can hear it, but if we don't do it, it's not going to help us.
Right. 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 because it won't come to you when you need it.
Oh, you'll have to have somebody else remind you. Well, as we wrap up today, there's a couple things. One, how do listeners find out more about you and potentially look into your online course when it's ready? And yeah, let's start with that.
My website is mybodyworksnatick, because that's my town,
Okay.
.com. So mybodyworksnatick.com, Natick. I don't know if you're
Okay.
going to put a link in or not.
Yep. I'll put a link in
Um,
this in the show notes.
okay, that's where my courses will be
Okay.
located. They're not quite yet ready.
Mhm.
Um, I also have a YouTube channel, and that's under Ellie Calhoun.
Okay.
And I'm on Facebook. I have a Facebook business page, My Body Works.
Okay.
Yeah.
I will put all of those links on how to get a hold of Ellie in the show notes. So whether you like Facebook or YouTube and wherever I will have the links on there. And people can find you. So find out more about this interesting things that you're doing and can't wait for your course to come up. So, but as this
Yeah,
last,
thank
I
you.
appreciate you being here. And thanks for joining me today, Ellie. And it's been a pleasure. But as we wrap up, is there one thought or quote that you would like to leave the listeners with today?
My content on YouTube is turning more towards self-care. So you might not be an expert or a specialist in health and wellness. You might not have the knowledge that a doctor has.
Mhm.
But I would like everyone to know that you're the expert on you.
Very good. Yes.
You have access, if you take the time and attention to get there,
Mhm.
to listen in, you
Mhm.
have access to an amazing inner wise one. We know what we need to do.
Mhm.
And I'm not saying don't go see the doctor or don't use Western medicine or whatever. I'm just saying make sure you check in with yourself so that you can know what the best decision is. And doctors should be helping you, not taking charge of you. You need to take charge of you. So what I like people to know, and this is sort of my tagline, is remember, it's your body, it's your wellness. Take charge.